Good afternoon. My name is Parixit Modi. The title of my study is Assessment of Burnout within a Health System Pharmacy Department. The authors of this article are Shannon Cross, Natalie Gardner, Nancy Jarosi, Tamara Mekmath, Anand Gupta, and Bela Mehta. The primary chapter associated with this study are Chapter 4, Principles of Human Communications, some articles that we studied during our course, Competency of Senior Communicators by Gregory 2009, Dealing with Demands by Gilstrap and Bernier 2017. Burnout is the state of physical and mental exhaustion. It can often result in decreased productivity, high attrition rate, and disengaged employees. It can result in medication errors and patient harm. So the consequences are even more worrisome in the healthcare settings. Not many studies exist to demonstrate burnout in the field of pharmacy. The study was performed to quantify the burnout in the health system pharmacy department as part of the quality improvement process and highlight the strategies to overcome the burnout. Participants' design and the result of this study. So the study surveyed 684 Ohio health pharmacy interns, residents, technicians, pharmacists, administration members, and support staff at 11 hospitals involved in inpatient and outpatient services. Participants were identified using the Outlook list serve. During the 3-week survey collection period, the research team conducted site visits at all work locations to present burnout statistics and encourage pharmacy associates to complete the survey during allocated staff meeting agenda time. Study data were the survey completed by these healthcare professionals. The survey questions comprised of MBIHSS Burnout Index questionnaires and supplemental demographic questions. The researcher used descriptive statistical tools to analyze these questions. The primary endpoints were emotional exhaustions, depersonalization, and personal accomplishment. Secondary endpoints were demographics, work characteristics, position, year of service, how many hours worked per week, shift type, and some open-ended survey questions to elicit information on the causes of stress during the workday. Some personal actions are taken to reduce the stress, and strategies or initiatives the employer could provide to alleviate stress. Of the 684 pharmacy associates who received the survey, only 277 participants responded. The participants who responded were predominantly female, 69.7%, 50.9% were pharmacists, majority worked 40 to 60 hours per week, and their worked shift was the first shift. 192 of the 277 participants, 69.7%, responded to have an emotional exhaustion score equal to or higher than 17, signifying moderate or high emotional exhaustion. 68.6% had a personal accomplishment score equal to or higher than 32, indicating moderate or high level of personal accomplishment. 37.2 or 103 participants had a depersonalization score equal to or higher than 7, indicating moderate or high level of stress. The survey revealed many essential details regarding burnout and the work related stress. 70% of the participants were experiencing moderate to high levels of burnout. Shift type, hours worked per week, years of service had an insignificant impact on the stress. However, gender disparity existed as more females than males expressed fewer personal achievement in the survey. The major contributing factors for the work related stress were workflow, controls such as changes, interruptions, and the community of the people they work with, managers, team members, lack of communications, life stress. Now, some necessary steps that can be taken to alleviate stress are to improve the workflow, improve the staffing, create a culture of life and work balance and overall well being. Strategies to achieve becoming the workplace of choice for personal and professional fulfillment. Staffing workflow adjustment strategies include adequate staffing, better training, defined workload expectations, and or standardized workflow. Culture of well-being strategies include dedicated project time, calming space, blackout window for email communications or meetings, massage therapy, encourage lunch breaks and time off, and education on stress reduction. What are some of the strengths and weaknesses of this study? The strength. Not many studies were done on the hospital pharmacist. So, this study is essential in that sense to bring awareness about the burnout in this group of people. The study used the established criteria to quantify burnout index such as MBIHSS. It is essential to use the established criteria so it can be compared easily across different health departments, facilities, and professionals. Some limitation of this study are that the study was performed only in one organization, so the sample size were also very minimal. The burnout index of one organization cannot be implied to other organizations. Another weakness of this study was the study was conducted based on the survey result, which is kind of subjective measures. I think we can improve the study result if we can incorporate some of the objective measures, such as how many pharmacists are diagnosed with depression, cardiovascular disease, how many pharmacists are leaving the workplace and looking for another opportunity because of work related stress. So if we incorporated those kind of objective measures, then study could give us more insight. Some of the discussion questions. First question, why are pharmacists at a higher risk of burnout? Second questions, many pharmacists are now equipped with the technological advanced instruments. So how can the technology help pharmacists to relieve the work related stress? What are some things that could be done at the personal level to relieve the stress? And should the healthcare organization be reimbursing for these expenses? Also, what are some steps that your organization can take or currently taking to reduce the burnout? So, to conclude, this study was performed to quantify the burnout in the health system pharmacy department as part of the quality improvement process and highlighted the strategies to overcome the burnout. over 70% of participants responded with a feeling of burnout. Burnout is impeding adequate healthcare delivery and it should be addressed promptly. Some required steps involve changes at the organization level, such as proper workflow design, better communication, and creating overall enhancing, improving teamwork environment. Thank you.